Fairground Attraction and Perfect on BBC Radio Lancashire. A very good afternoon to you, Gilly, till 4 o'clock this afternoon, and then Gary Hickson from 4.
Health, hobbies, history and haute cuisine with Gilly in the afternoon.
BBC Radio Lancashire.
In recent years, we've made leaps and bounds in terms of our medical knowledge. Advances in healthcare are helping us to live longer and live better, but as some things improve, others unfortunately get worse. Now, we've used antibiotics to treat common ailments and infections for decades, but as time has gone by, they've become less effective. Some diseases appear to be evolving and becoming resistant to antibiotic treatments. And some experts have warned that if this trend continues, a day could dawn where antibiotics become useless in the fight against infection. But there is a bit of hope. My next guest is trying to fight back against these smart bugs. Dr. Mary Phillips-Jones is leading a team at UCLan looking at why these bugs are becoming resistant to treatment and what can be done to solve the problem. She joins me this afternoon to talk about the scale of the issue and, of course, the work of her team. Welcome. Let's talk a little bit about your background first. You've extensively studied microbiology over the years. Where did your interest in the subject come from, and why did you decide to make that particular subject the focus of your work?
Well, it's a lot of years ago now that I started out in my scientific career, I suppose. And when I was starting out, I wasn't sure what I wanted to do at 18. So I decided to do a sort of general biological topic at university. And as I studied different subjects, I was interested in the microbiological side of things and decided to sort of focus more on microbiology because there are so many challenges, I think, in terms of trying to overcome problems that we have with infections in hospitals, in the community, and also in trying to harness microbes for our good, as well as trying to combat the bad infections agents as well.
Well, we've probably all, I think, at one time or another used antibiotics over the years. People will be familiar with things like penicillin and such, but what other common types of antibiotic are regularly prescribed for patients, would you say?
Well, penicillin is still used, though I'm sure everyone, your listeners will be aware that some people have allergies to penicillin, and it is the first antibiotic that was started to be produced commercially, and it's the first one in which we're seeing this rise in antibiotic resistance as the bacteria respond to the presence of penicillin in the environment. So on those two counts, scientists have looked for a whole range of different classes of antibiotics that are structurally dissimilar to penicillin and therefore have more zap power towards bacteria because they're not expecting something totally new in terms of antibiotics.
How do antibiotics work then? I mean, put simply, what do they do inside you when we take the antibiotic, and how do they kill off the infection?
Okay, so when the bacteria encounters the antibiotic, there's a number of different ways of killing that bacteria, depending on all these different structurally different antibiotics. So there's a whole range, but the ultimate aim, obviously, is to kill those bacteria. And one of the most common mechanisms for antibiotic action is basically to lyse the cells, ultimately. They start to die, they will lyse. And things like penicillin will zap the bugs open, they will explode open and die. And they produce a lot of debris in the process as well, which can be problematic. But that's another story, maybe.
That's another issue. What's gone wrong then? I mean, why have they stopped working? What's made them less effective than they have been in the past?
Well, the more that we've used antibiotics and become reliant on them, the more the bacteria have hit back at us. They have generated clever mechanisms for overcoming these the actions of our antibiotics. So they're very clever at overcoming what we throw at them. So with time, they will generate resistance to those antibiotics. And they have triggers for generating antibiotic resistance mechanisms. So that means that the antibiotic is no longer effective, that zap power, the killing power of the antibiotic is rendered inactive, and it just doesn't work. And the bacteria are not bothered by the presence of the antibiotic at all, and they carry on growing regardless.
I think for some time now, doctors have been loath to hand out antibiotics in many cases, where they'd normally have prescribed a course before. How long have we been aware, do you think, of the problem? How widespread is it? And is it just in this country, or is it on a global scale?
It's a global problem. Bacteria know no boundaries, geographical or otherwise, and we all need to be aware that wherever antibiotics are used, resistance will be generated. The bacteria that generate that resistance pass on that message, that genetic information, to their neighbours, the same strains, the same different species and different genera. So they pass it on like wildfire. So any exposure of the antibiotic in the environment unnecessarily is creating unnecessary resistance. And in the northwest, for example, we see different hotspots of where antibiotics are used more in some places than others, and that goes hand in hand with the generation of resistance that we see in those areas. Actually, Lancashire scores reasonably well. So in a score of 1 to 4, Lancashire, in terms of its antibiotic usage, is at the level 2, where 4 is bad and 1 is good. But we can't be too complacent, because elsewhere in the northwest there are some much higher consumptions of antibiotics where they score 4 out of 4. And because of this no geographical boundary, those resistances that are generated in those hotspots can transfer and pass to us over here or anywhere else in the country quite easily. And it is a global problem. We live in an era now where we travel by aeroplane to all sorts of destinations, and those resistance traits in those bacteria go with us and are transferred.
And I know that you're doing some interesting work at UCLan, which we'll hear about after 2:30 this afternoon on BBC Radio Lancashire. Here's question 2 for the Brainiest Borough. Dr. Henry Jekyll was one of the protagonists in Robert Louis Stevenson's famous novel, Exploring Good and Evil. Which nasty character did Dr. Jekyll turn into when he consumed a certain potion? 01254 583 583. Gary taking the calls this afternoon. 81333 by text. First word Lancs or Gilly at bbc.co.uk. Aha, take on me on BBC Radio Lancashire. That question 2, round 2 for the Brainiest Borough this afternoon. We crown the Brainiest Borough of the week at about 10 to 4 when Gary joins me in the studio. Dr. Henry Jekyll was one of the protagonists in the Robert Louis Stevenson's famous novel, Exploring Good and Evil. Which nasty character did Dr. Jekyll turn into when he consumed a certain potion? 01254 583 583 81333 by text. First word Lancs, that will cost you your normal standard network charge. You can email Gilly at bbc.co.uk.
Playing for civic pride, it's Lancashire's Brainiest Borough with Gilly in the afternoon.
BBC Radio Lancashire.
Well, with me this afternoon, I'm pleased to say in the studio, is Dr. Mary Phillips-Jones, leading a team at UCLan at the moment, looking into why bugs are becoming resistant to antibiotics. And I think we're always told that if we're given a course of antibiotics, we should finish them completely, even if we feel better or we think we're cured before the end of the course. Why is that? Why are we told to complete that course? Surely once we feel better, is it pointless taking those extra tablets?
No, it's extremely important to finish the course of antibiotics. And this is because of the antibiotic resistance problem. So if you don't see through that antibiotic a full dose treatment, what happens is there are bacteria lurking behind that didn't get zapped by that antibiotic. And those bacteria that stay behind and haven't been attacked generate resistance to the antibiotic. So they will then become immune to any later antibiotics that you use, and indeed they will distribute into the environment and become a problem generally to other people ultimately. So it is important to complete the course, because that way you know that we know that is likely to kill the problem completely rather than partly.
And when you're prescribed a course of antibiotics, how long do they take to get in your system? Because you do hear, conflicting reports of this, don't you? Does it take up to a couple of days, 48 hours or what have you?
Okay. I'm not surprised that there are some conflicting ideas out there, because different antibiotics take different lengths of time to get into your system. So it will depend on the antibiotic.
What other factors have had an effect on this problem? Some opponents say factory farming suggests that antibiotics are used regularly in some animal feeds, for example. Is that true? And if so, how does it affect us as consumers of the animals?
Yes, it has been true in the past. So some years ago, antibiotics were used quite widely in the agricultural industries as growth promoters. And as time went on, people began to make a link with the fact that antibiotic resistance was being generated through quite a lot of usage of these antibiotics for animals. And ultimately, because they get into the environment, they could be passed down to us in hospitals, for example, and therefore exacerbating the antibiotic resistance problem. And therefore, when this was recognised some years ago now, all growth-promoting antibiotics in agricultural use have been banned for some years. And research following that ban has now revealed that that was an effective move. And now the level of antibiotic resistance arising has dropped quite significantly. So that has been a really good positive step.
We'll come back, we'll chat some more between now and 3 o'clock. This one takes us to the guide at 20 to 3. A couple of ideas and suggestions, things to see and do over the next couple of days on BBC Radio Lancashire. And of course, how you can get your event on the guide as well, something we do every afternoon. Somewhere between 2:30 and 2:45. Question 2, round 2, it's 2 points. Dr. Henry Jekyll, one of the protagonists in Robert Louis Stevenson's famous novel exploring good and evil. Which nasty character did Dr. Jekyll turn into when he consumed a certain potion? 01254 583 583. Let's have a look at one or two ideas and suggestions of things to see and do, something for the weekend.
The Guide. Find out what's on and where.
On BBC Radio Lancashire.
A couple of things to mention. First off, the small corner of the world on today until the 12th of June. That's taking place, of course, at the Winmarleigh Village Hall over wire. We heard all about this when we were in Fleetwood a couple of weeks ago, of course. Hello, Wesham. It's the Family Fun Day tomorrow starting at 2 o'clock. Tomorrow, Fleetwood Road in Wesham. Licensed bar, hot food stalls, crafts and face painting, amongst other things. Currently on and going very well, the Ribble Valley Cycling Festival on until the 12th of June. If you want further info and details, 01200 425 111 if you fancy nipping along there before Sunday. Also as well, the Ruff's Dog Show. It's a great show, this. I was involved in this a couple of years ago. I judged this. The Friends of Ashton Park are presenting Ruff's Dog Show 2016. A couple of new features this year, one being the musical Sit and the Best Fetch as well. Not sure whether they have the category, where the dog looks like the owner or not, or whether they don't do that anymore. Anyway, it's tomorrow between 11 and 4. Ashton Park in Preston. Nip along, take your pooch along too. Stage Struck Theatre Group are presenting Alice in Wonderland at Lancaster's Grand Theatre. On until tomorrow, 7:30 start. A tenner will see you through the door. Concessions £8. The box office, 01524 646 95. Couple of events for Sunday. A treat, I'm told, awaits you at the Plessington Priory this Sunday afternoon at 2:30. The Blackburn Music Society are presenting its final concert for a very successful season with a varied programme of contemporary music. Tickets £6 on the door, free to the under-19s. And one final one, cracking place, Samlesbury Hall this coming Sunday. The plant fair will be on. Some new nurseries in the lineup, selling shrubs, small trees, alpines as well. Get some free advice, go along, have a look round the hall. Admission to the hall and plant fair totally free on Sunday. Ideas and suggestions, things to see and do. It's something I do every afternoon at this time on the programme. If you want to get involved, this is how.
Share your events.
Email lancashireguide@bbc.co.uk.
133 by text, first word Lancs. That will cost you your normal standard network charge. You can email Gilly at bbc.co.uk. My guest this afternoon is Dr. Mary Phillips-Jones from UCLan, doing some very important work at the moment, having a look at why bugs are becoming resistant to antibiotics. Just tell us about the team that you're working with and about the work that you're doing, if you would, Mary, please.
Yes. So what we're doing in our research is working on the receptors that are in bacteria that actually sense the antibiotic in the environment. And this is important because it's as a result of sensing the antibiotic in the environment that they then switch on their virulence, their antibiotic resistance genes. And therefore, we figure that if we can characterise how the antibiotic is sensed and all the other events around that go into switching on the resistance, that we can then design new drugs which basically blindfold the bacterium from realising that the antibiotic is there in the environment, and hence the resistance genes don't get switched on. The bacterium is literally blind to the fact that the antibiotic is there, and so it doesn't switch on its resistance.
And this is a joint project, I think, isn't it, this?
Yes, this is a joint project with the UK's synchrotron source at Harwell, the Diamond Light source. And we also work a little bit with Steve Harding at the University of Nottingham.
And we know Steve very well from his Viking connections,
yes,
of course, with his research into the Vikings.
Oh, yes. Steve works on hydrodynamics also, and we use some of his techniques to understand our receptors for antibiotics better. And also with the Diamond Light source. And in fact, the Diamond Light source and us at UCLan share a PhD studentship to develop this work. And the person that's doing all the hard work behind this is Charlotte Hughes, who is from Darwin, actually, and her family are in Darwin.
Wow, and she's doing great work. She was actually on telly in the House of Commons, I think, recently.
I'm not sure about the telly, but she was selected amongst other people to present her research work, our project, at the House of Commons in the SET for Britain competition in 2016.
What do you hope to achieve? How hopeful are you that there is a solution out there?
Well, it's hard to say in the initial stages. So it's only by investigating these receptors and these processes that we get a better understanding of whether we can find new drugs to disrupt them. So doing the research is important at all levels to understand these antibiotic resistance mechanisms better. And it's only by understanding them, as I say, that we'll be able to design, become more clever than the bugs that are producing this resistance and combating them and their clever mechanisms, really.
If the day comes when the bugs are a bit too clever and your research doesn't pay off, can you see a day when antibiotics effectively become useless for the treatment of common ailments? What would we do then? Are there any alternatives?
OK, well, we're already in that era now. So in the EU, there are 25,000 deaths per year from infections that we cannot treat with antibiotics. And it's predicted that by 2050, if we don't do something, that there could be as many as 10 million deaths in the EU by 2050.
Wow. So obviously your research and your work very important at the moment?
It's very important to try and discover new drugs, but it's also important to look after the antibiotics we've got already. And this is why the government and Public Health England are bringing in strategies for protecting the antibiotics we've got, reducing the chances of resistance being generated. And this comes from good antibiotic stewardship. So it's a case of, when you go to the GP, with a cough or a cold, perhaps don't ask him for antibiotics. They will be prescribed if it's necessary. Only 10% of us turning up with a cough or a cold, only 10% of us, in 10% of cases, will antibiotics actually be effective. Mostly they're not, because most of these coughs and colds are viral, and therefore antibiotics don't work against viruses. So it's a useless use of antibiotics, and all that happens is they get into the environment and generate resistance. So not asking for antibiotics, and as we mentioned earlier, if you are prescribed antibiotics, then use the full course, and any that you have left over, don't throw them away. Don't throw them in the bin. Don't flush them down the loo. If you have any antibiotics left over, the advice I think would be to ask to see if your pharmacist would take those unused pills after the treatment's finished, to see if they will dispose of them so they don't get into the environment.
Well, interesting topic. Thanks very much indeed for joining us this afternoon. That's Dr. Mary Phillips-Jones from UCLan. Hope you'll keep in touch with us and how the research is going and everything.
Well, thanks very much.
Excellent.
I'd love to.
Thank you very much for joining us this afternoon on BBC Radio Lancashire. Gilly, till 4 o'clock, we'll be finding out about the later stages of the last choir singing. The big final, of course, just around the corner, happens next Friday evening at King George's Hall in Blackburn. More on that on the way after the news at 3. That question again, question 2, Dr. Henry Jekyll, one of the protagonists in Robert Louis Stevenson's famous novel exploring good and evil. Which nasty character did Dr. Jekyll turn into when he consumed a certain potion? The answer on 01254 583 583. That's the number to call this afternoon. 81333 by text. First word Lancs, that will cost you your normal standard network charge. You can email Gilly at bbc.co.uk. Cricket tonight, T20 of course, at 6 o'clock this evening on all frequencies with Scott Reed. More on that later.
Loving the Red Rose County.
On air, on your mobile, and on your PC.
This is BBC Radio Lancashire.